Whitney. So we've already done the head to toe assessment, so now we're going to go ahead and we're going to do the cranial nerve assessment.
Okay.
So we're going to go through and I'll explain step by step what I'm going to need you to do to test each cranial nerve. Okay? All right. So the first one that I'm going to do is the olfactory. So what I'll need you to do is I'll need you to close your eyes. Thank you. And then I'm going to have you occlude one of your nostrils, and I'm going to have you try and smell what I've got in this cup here. Go ahead and take a sniff. What do you smell?
Coffee.
Very good. All right. Go ahead and close your eyes again for me. Perfect. And sniff. And then what do you?
Smells like chocolate milk.
Very good. It is chocolate milk. Shaking things up on you, so you can go ahead and open your eyes again. So that's good. Means that you can smell normally. Now I'm going to go ahead and do the optic. So what that means is I'm going to have you cover an eye. You can pick whether your right eye or your left. And then your other eye will stay open. I'm going to move my finger and see if you're able to follow just with the one open eye, my finger as it moves.
Okay.
Okay? All right. And keep your head still for me. Okay, and then we're good. And if you go ahead and do the other eye then. Okay, very good. You can uncover both. And you were able to follow easily. Any discomfort with that at all?
No.
Perfect. Okay, the next one, I'm actually going to be testing multiple nerves at the same time with this next one. So I'm going to be checking your third, fourth, and sixth. So that's your ocular motor, your trochlear, and your abducens. So what I'm going to have you do is, without moving your neck, you can keep both eyes open. I'm going to have you follow my finger as it makes a pattern,
Okay.
and see if you can follow with both eyes, okay?
Okay.
So we're just going to start. Okay, very good. Any pain or discomfort with that?
No.
Okay. Now we're going to do what's called a cover and uncover test. So I actually just have a little package here that I'm going to hold up over an eye to have it covered. What I'm going to need you to do while we're doing this is have you focus, say, over here on the door, just so
Okay.
you have that distance to look at. And you're not supposed to really be moving your eyes or following the cover. I just want to see how your eyes respond to this, okay?
Okay.
So I'm going to cover up your left eye first, just so you know, okay? So just keep staring ahead for me. And I'm just going to do it one more time. Okay, now I'm going to come and keep looking ahead for me. I'm going to do the other eye. Okay, that looks good. So looks like it's normal sensory findings at this time, with no nystagmus noted. Next, I'm going to check your fifth cranial nerve, which is your trigeminal. So for this one, I am going to have to actually palpate and kind of touch along your jaw.
Okay.
So what I'm going to do is I'm going to put my fingers here. I'm going to go ahead and have you clench your teeth tight for me, and you're just going to feel me. Feel again. Okay, you can go ahead and relax. What I'm going to do next is I'm going to grab a cotton tip applicator. I'm going to have you close your eyes, and when your eyes are closed, you're going to feel this touch various parts of your face, and I just need you to tell me where you can feel it at.
Okay.
Okay, so I'm going to do 3 different areas. So here's the first one.
Forehead.
Okay, and then,
Right cheek.
okay,
Between my chin.
okay, perfect. And then I would also test the corneal reflex. I would take the cotton and roll it across to check a corneal reflex on her as well. So right now I have normal sensory and motor skills at this point. The next one is the 7th nerve, which is your facial. So what I need you to do, I need you to smile at me, please. Okay, and then go ahead and frown. All right, and can you raise your eyebrows? All right, so everything on that's normal because it was equal on all sides when you did that. The next one that I would test would be the auditory, which is the 8th cranial nerve. If I had access to a tuning fork, I would use it to test both the Weber test and the Rhine test. The Weber test is I would place a tuning fork on the midline of the skull, and then if it was the Rhine test, I would place it on the mastoid and then the inner ear canal. Not actually place a tuning fork on the inner ear canal, but hold it in that area, which would allow me to assess both the lateralization and also the air conduction and she should be able to hear where or feel even where that tuning fork is located. The next ones I needed to check are the 9th and 10th cranial nerves, which is her glossopharyngeal and also her vagus nerves. So Whitney, for this part, we are going to be using your mouth some. I am going to have to elicit a gag reflex on you. Do you have an overly sensitive one that I need to know about? Okay. So the first thing I'm going to do is I'm actually going to check your gag reflex. So using the cotton swab, I'm going to have you open your mouth for me. I am going to touch towards the back of your throat, just to get the gag reflex from you. Okay, go ahead. Okay, got a gag reflex for you. Sorry about that. I know that's not pleasant. And then if you can have your mouth open again and swallow for me. So I can see, yep. I just need to be able to see the inside while you're doing that. And then I am going to go ahead and open again for me, please. And then, perfect. And then can you go ahead again and say ah for me? Ah. Okay. And then, okay. So right now she's got a normal gag. She does have a normal swallow. The uvula remains midline and symmetrical. And I was able to watch for the up and down movement as well with all of that. And then the next test I need to do is the 11th, which is your spinal accessory. So what I'm going to do is I'm going to put my hands on your shoulders. I am going to give you some resistance, and I need you to try and shrug your shoulders against that resistance.
Okay.
Okay, so go ahead and try. Very good. And then I'm going to have you try to turn your head against resistance. So go ahead and try and turn your head. Okay, try and turn your head. All right. So then that means that that's intact. She was able to shrug and move head against resistance. And then the final cranial nerve is the 12th, which is your hypoglossal. So I'm going to have you stick your tongue out for me, please. Can you move it side to side? And then are you able to curl it up? Very good. And now I'm going to put my hands on your cheek. What I need you to do is try and, as I'm pushing in on your cheek, take your tongue and try and push back out. Does that make sense? Mm-hmm. Okay. So go ahead and do your, yep. Now do your other side. Perfect. So your movement is normal. Didn't look like you had any problems with that, and your strength is normal as you pushed against my hand. So right now it looks like Whitney's 12 cranial nerves are all intact and functioning normal, and that's the end of my cranial assessment.